Good afternoon, everyone. Thank you so much for tuning into this mini diabetes learning session. I am Joanne Voorhees Collins, aka Coach JJ, your resident diabetes management coach. Today, we're going to explore an important topic that affects many individuals that are managing diabetes, and that is the topic of the impact of steroid medications on our blood sugar. So let's go ahead and dive in. And just to get us started with what we're going to talk about today, we're going to talk about what steroids are, where they come from, why they're prescribed, how they work, and what you can do to minimize their impact on your blood sugar levels. So let's start by breaking down what steroids actually are, where they come from, and their basic history in medicine. Steroids are chemicals that are produced by the endocrine glands, specifically the adrenal glands in our body. And these chemicals affect all of our body systems, everything from our metabolism to our temperature, our mood regulation, our reproductive capabilities, and especially our immune system response. And while our bodies definitely produce steroids naturally, sometimes we don't produce the right ones in the right amounts, and therefore they are commonly prescribed to treat a variety of medical conditions. One key steroid in our body is cortisol. This one is produced by the adrenal glands, and it is produced in response to immune system activation and stress. Cortisol has critical roles in our body, such as stimulating the production of new sugar in our liver when our liver thinks that we don't have enough. And it also can control our blood pressure. Some other things that it does is, unfortunately, it can decrease calcium absorption, and it can actually affect our state of alertness. The cortisol produced by the adrenal glands is actually part of the cascade of chemicals that are involved in our flight or fight response. The chemical action of steroids was actually discovered in the early 1930s. Scientists at that time noticed that cortisol that was extracted from animal adrenal glands were actually able to have an impact on human cells, basically in the same way that our own cortisol did. Around 1948, patients started being treated with corticosteroids, cortisol specifically, and this was actually really groundbreaking. By 1948, this was, I think I've read something like 6 patients had been in the initial trial, and eventually they were able to figure out how to create synthetic steroids in the laboratory and started using them more widely to treat things such as rheumatoid arthritis, a variety of autoimmune disorders and things like that. Unfortunately, they had to develop some other medications to give alongside of these steroids because the formulations at that time did carry some risk of toxicity and some unwanted side effects. As time went on through the 70s and 80s, your professional athletes, pro wrestlers, and bodybuilders became aware of the impact of steroids on muscle growth and development. And so they became all the rage with these athletic professionals. Today, we use them for just about everything. And chances are that if you're watching this presentation right now, at some point you have been prescribed one steroid or another. So let's look at why or how they work and why we prescribe them in traditional healthcare. The main effect of steroids is to cut down on inflammation. Our body kind of has a love-hate relationship with inflammation. It's necessary and helpful for our body to go through this process, but sometimes our body can get carried away and doesn't know when to stop the inflammatory cascade. This can happen in autoimmune disorders, immune system hypersensitivities, allergies that are severe. And since COVID, we now know that this can actually happen by the persistence of infections or the long-term effects of infections. Steroids are also used to keep the body from rejecting transplants, They're used in reproductive health issues, particularly for women, and also for pregnancy prevention. There are several types of steroids that are actually prescribed to the general public. These steroids can be taken in pill form, patches, injections, IV, inhaled, or in a topical cream. And I'm sure that many of us have used cortisone 10 or some similar store brand of the same thing for the treatment of rashes and insect bites, poison ivy, and things like that. Some of the conditions that steroids are prescribed for could be, for example, having a really severe respiratory infection where you're not able to breathe well. So maybe you're given like a steroid, dose pack for 5 days. Some people might have chronic obstructive pulmonary disease where they have to take a daily inhaler that's got a steroid in it. Some people might have inflammation directly related to cancer treatments like chemotherapy and radiation. Some people might have arthritis, and maybe you're on your way to a knee replacement, but your doctor doesn't think you're quite ready yet. So they give you a steroid injection in your knee to help with the inflammation and pain until you're ready for surgery. And so these are just a few of the things that we use steroids for in clinical practice. So now let's talk a little bit about how they work. As you can see in its name, it says glucocorticoid, which literally means that this chemical stimulates the production of glucose. In the human body, this happens in the liver. These glucocorticoids, steroids, tell the pancreas, hey, calm down on the insulin, jack up the glucagon because we are fighting a war over here and we need fuel and ammunition. And so these chemicals then signal to the liver to create glucose and release it into the blood to fuel our body systems to fight this war of inflammation. So as we've covered, we know that steroids are used to control inflammation. When we have inflammation, the chemicals themselves that are inflammatory actually also signal to the liver that we need more glucose for energy. When this happens, the liver goes into hyperdrive and starts converting fats and proteins into glucose because it just knows we need energy now. We have to do it now. We have to do it now. We have to do it now. So in the setting of a person that already has diabetes, that already has some difficulty keeping the blood sugar normal with just, nutrition and fitness and things, the steroids make it extra challenging to keep the blood sugar at an acceptable limit and stable because you're now giving 2 steps where glucose is being forced to elevate in your circulating bloodstream. And it can even be more of a challenge if in your specific case of diabetes, you are either insulin resistant or your pancreas simply isn't producing enough insulin to begin with. So, of course, the $1 million question, why in the world would your doctor give these to you if they knew that this was going to raise your blood sugar when, we're trying to prevent that from happening, right? And then, of course, well, what in the heck do we do about it to help ourselves? So now we're going to cover that. First and foremost, your healthcare provider was trained in school to understand the risks and benefits of the medication that they're wanting to prescribe for the population as a whole, but also for you as their individual patient. It's their job to look at your entire medical picture of what's going on and then weigh the pros and cons. And if you are being prescribed these steroid medications, it is because your healthcare provider has made the determination that the benefit of stopping the inflammation from whatever issue you have going on is greater than the risk of allowing the inflammation to continue. If you can't breathe, we've got to open up your airways. If you have swelling, we need to stop that from cutting off the flow of blood and lymphatic fluids and irritating your nerve bundles. If your body is attacking its own cells, we have to tell it to stop to prevent healthy tissue from being damaged. These things most certainly outweigh the risk of temporary high blood sugar. What you can expect when you take a steroid and you have diabetes is that your numbers will be higher than normal for the next several days. For some people, the body adjusts very quickly. Blood sugar has a little blip, goes right back down, no problem. For other people, this can last up to 10 days because the body is just kind of freaking out and slow to regulate itself. In this case, you should ask your provider who's prescribing the steroids for you whether or not they think that you need to modify anything. Do you need to modify your medications? Like, do you have to change the time of day that you take them or the time you take them in conjunction with when you take the steroids? They might want you to adjust the dose of a medication. So if you're on a medication like metformin or glipizide or something, they might want you to take a slightly higher dose for the next week or so. Don't ever do anything like that without talking to them first. They're the doctor. That's their job. Their job is to direct you in these things. However, you might find that the provider that prescribed you the steroid medication, you say, hey, doctor or nurse practitioner or whoever it is that you're seeing, hey, I know that these things can raise my blood sugar. Is there anything special I'm supposed to do? And some of them will say, it's just temporary. We know what's going to happen. You got to have the steroid fix thing. So don't worry about it. Just don't go eating a box of donuts or something. Well, on the one hand, I can certainly understand why the provider might say that. On the other hand, guess what? There's actually stuff that you absolutely have within your power to do to help yourself minimize the impact of the steroid to your blood sugar stability. So now we're going to go over that. Number one, you do not have to have special permission from your healthcare provider to check your blood sugar more frequently. That's actually the starting place. You have to be checking periodically throughout the day at random and after meals to see how this particular steroid affects your specific body and your response to food. Even though you usually respond a certain way to a particular type of food, the steroid treatment can throw that off. So it's important for you to be checking, to be monitoring what your body is doing at regular intervals. Next thing, you can definitely drink more water. Unless you have specifically been given an order or instructions by your healthcare provider that you have to avoid extra fluid because you have another condition like a kidney issue or a heart issue that affects your fluid balance. Unless you've been told to watch with the fluid, water is your best friend, especially while you're on steroid treatment. Water is extra important during the course of steroid treatment because the steroids don't just affect your production of insulin and glucose. It actually also affects your body temperature. And the higher your body temperature goes, the more condensed and thick your blood actually gets. Just like gravy in a pan, the longer you cook it, the thicker it gets. Same thing happens to your blood. And so your blood vessels need the water to keep the blood flowing as it should. You also can pay attention to the foods that you're eating, and you can opt for lower carb, higher fiber, and higher protein. This will not only help your body by not adding more components of glucose when it already has too much on hand. It helps by increasing vitamins, minerals, and antioxidants that are all part of the process of helping you heal. Here's where eating to the meter comes into play. If you are checking your number and your meter shows that you are higher than your target range that your provider gave you, then you will need to eat accordingly. If you haven't figured that part out yet, now would be a great time to learn about this concept, and I'll post some links to some materials in the comments below this video. Finally, you can increase your physical activity. provided that you don't have an injury or condition that requires you to have minimal movement or minimal weight bearing. Even if you have some mobility trouble because your knee buggers you or whatever have you, you can still stretch. You can do exercises sitting in your chair. You can even do some exercises while you're in bed. Every little bit of extra movement is helpful. This movement actually allows your muscles to burn the excessive glucose that they're storing, and helps the waste products produced by the inflammatory process to be removed from your body more quickly. Sometimes, though, you are going to need to be speaking with your doctor, or you may find that you need to be evaluated right away. Let's lay out when those situations occur. Number one, if your blood sugar goes to above 300 and stays that way for consecutive readings, or if your blood sugar goes above 300, it dips down for a little bit and then comes back up, and you're having a little dip, but you're going back up to above 300, this is an indication that your body might need some extra help, and it's up to your healthcare provider to decide what to do. But they won't know unless you're in contact with them. So as I mentioned before, this can look like changing the time of when you take the medication, how far you separate the medication from other medications you might take. It could mean they want you to take more. It could mean they want to add a medication or two just temporarily while you get through this period of treatment with the steroid. Again, if you're not calling your doctor and telling them, they have no idea that there's a problem. Slightly more importantly, if your blood sugar goes above 400, this is considered to be a medical emergency and needs immediate evaluation and treatment to stabilize you. Why? Because above 400, all of the research and all of the standard of care practices throughout all of the medical institutions, at least here in the United States, indicate that you could be at imminent risk for developing diabetic ketoacidosis. And that is a terrible condition, and it doesn't work out so well. In fact, most people, when they are initially diagnosed with diabetes, actually find out because they were in ketoacidosis and ended up in the intensive care unit at the hospital. And then, oh, well, you have diabetes, your blood sugar was like 600 something. So your blood sugar gets up to 400, get yourself to the closest ER. And if the ER is a while away, get yourself to the closest urgent care clinic, or even just any doctor's office. If there's cars in the parking lot, go let them check you and direct you. It's really important. I don't want to see anybody, ending up in the hospital from this, when it definitely can be prevented if we're proactive about what we're doing. Unfortunately, a lot of healthcare providers have this belief that ketoacidosis is very rare in type 2 diabetes. It mostly happens in type 1. Unfortunately, that's not true. They need to be concerned, as do you. And if you don't feel like you're getting an appropriate response from your healthcare provider, take yourself into the ER and tell them that you've reached out to your doctor and they didn't get back to you, or that you were concerned. Either way, once you get to the ER, they are required to help you. Other instances in which you need to be in contact with your healthcare provider is if you find that the condition for which you're being prescribed the steroids actually gets worse. More swelling, more pain, more difficulty breathing, things like that, you need to call them and tell them, because maybe they need to give you an increased dose of the steroid. Maybe they need to give you a different version of the steroid. I mean, this is why we have, 10 different medications for the same condition, because not everybody responds to each one exactly the same way. Another issue is that if you end up developing new symptoms, especially any rashes, swelling, shortness of breath, anything that indicates an allergic reaction, you got to be on the phone with your doctor about that right away, so they can tell you what to do next. Maybe you have to continue taking the steroid even though you're having an allergy reaction, and there's medications they can give you to stop the allergy reaction. But you won't know unless you talk to your provider. Final thing is, unless your healthcare provider told you something different. If your number stays significantly above your targeted range that the provider told you they want you to stay in for your blood sugar, if it's still significantly elevated more than 10 days after you have stopped taking the steroid treatment, this is something that your healthcare provider is going to need to investigate. Some people have a very difficult time getting their body to go back to normal after steroid treatment. And they literally call this steroid-induced diabetes. This is, again, it's uncommon, but it does happen, and it's something that your provider needs to be mindful of. So let's recap what we went over today. Steroids do in fact raise your blood sugar, sometimes quite significantly, because they tell your liver to make lots of sugar and they suppress your response to insulin. Things that you can do to help avoid any problems are test to see what your body is doing. Talk to your healthcare provider about what they think you should do during the course of steroids. Increase your fluids, reduce your simple carbohydrate intake, and get as much physical movement as you possibly can. And never, ever, ever hesitate to call your healthcare provider if anything arises that has you concerned, especially the high numbers, worsening symptoms, or new symptoms. So I hope you found this presentation to be helpful in your understanding of how this works. I hope you may have found it somewhat reassuring. If you have any general questions, you're always welcome to message me on Facebook, or you can email me at my brand new email address. That's diabetes101.coaching@gmail.com. If you wish to contribute financially to my volunteer efforts so I can cover the cost of the technology that I use to present such lectures and learning sessions, you're more than welcome to find me on PayPal and Venmo. You can find that information listed on this slide right here. If you are new to managing your diabetes, or you've arrived at a place where you need to start from square one, you may want to consider purchasing my book, the Diabetes 101 Playbook Journal. That's available on Amazon. Just type in Diabetes 101 Playbook Journal, and it should bring you right to my book. If you feel that you would benefit from one-on-one live virtual coaching, I am available for that. However, I do require that all potential clients that want to work with me complete some surveys first. And that's to ensure that we're going to be a good fit together for your specific situation. So if you're interested in any of that, feel free to message or email me. I can't currently take insurance because they haven't set up the billing for that yet that allows me to do that. However, health coaching services are covered expenses under health savings accounts and flexible spending accounts. So consider hiring yourself a health coach. Doesn't have to be me. I'd love it to be me, but you might find one local to you that you can go sit down with in person. Check it out and see what you can do. And on that note, once again, thanks for tuning in today. I hope everyone has a fantastic remainder of the day, and Coach JJ out.